Hi, my name is Zoe Herrera, and I will be discussing a management case study for our class. And I will be discussing the 5 functions of management one by one. So the main point of this case study was connecting heart failure patients to providers through remote monitoring. It's a strategic initiative center on making patient care more affordable and accountable through providing integrated evidence-based patient-centered care. So the first function is planning. Planning is deciding what to do and how to do it. It's very future-oriented. The examples I found on planning on the case study is that they were on a mission to include a commitment to its community and recognition that increasing value and continuously improving quality are essential to maintain operational excellence. And they wanted to enhance patient care, teaching, and research. A top strategic priority was to reduce 30-day readmission to improve the quality of patient care. They wanted to make processes as seamless for transitions from a hospital to other care settings essential. They wanted to make that one of their top priorities. These are all the plans of the program to decrease readmission to hospitals. And the initiatives that work towards these goals is including providing patients with critical information at discharge to promote safer transition, using transition teams and healthcare centers, participating in the Center for Medicare and Medicaid Services, the pilot demonstration, and programs that connect chronic care patients with specialized outpatient care services. So these are the examples I found on planning from the case study, because these are all the things they are going to do to work towards the goal to make the readmission to hospitals with people with heart failure lower, to decrease it. The next function after planning is organizing. And organizing is making arrangements or preparations for an event, or to coordinate or be a coordinator for an event. And examples that I found on that were they created a 30-day readmission rate chart showing all the rates for acute myocardial infarction, heart failure, and pneumonia in different hospitals. So just by doing a chart that's already organizing, it could be a pie chart, line chart, whatever type of chart rates like they did here, that is an example of organizing. Connected Cardiac Care Program, also known as the CCCP, is developing new ways to help patients at risk for hospitalization to manage their heart disease. So they're already making developments on how to manage these patients. And the ways they wanted to do that is by integrating technology into remote patient care, and they wanted to support self-monitoring as well. So you don't want to just be monitored by nurses or any of that. You want to also monitor yourself. So that was 2 ways they wanted to organize and do things to lower the rates. So the next function is staffing. This is the third function. Staffing is obtaining and retaining people to fill jobs and do work. So as an organization or program, we need to be provided with staff. And staff, for management, they need to design jobs for the staff, develop staff, and by acquiring new knowledge, evaluate workers by using appraising performance. So in the case study, the examples that I found was at Harvard Medical School, the nonprofit organization employs more than 50,000 physicians, nurses, scientists, and caregivers. The second example I found was PCH encompasses more than 5,500 employed and affiliated physicians and 7 acute care hospitals within the system. They believed that dedicating staff members to the implementation and oversight of the program is more critical than the technology itself. Healthcare is a service provided by people, so managers must excel at staffing because we need to make sure the staff knows what they're doing to help the goal that we want to achieve. So that's why staffing is so important, because we need everyone on the same page, making new developments, goals, and innovations to decrease this issue. The fourth function is called directing. Directing is defined as a process when the managers instruct, guide, and oversee the performance of the workers to achieve predetermined goals. So the examples I found in the case study were that partners have launched efficient care designs efforts for the 5 conditions such as diabetes, acute myocardial infarction, coronary artery bypass graft surgery, stroke, and colorectal cancer. CCH's program supports mobile health initiatives, including prenatal care text messages for expecting mothers. So it'd be really cool to have like automatic text messages to remind you to take your prenatals or anything, that an appointment for expecting mothers, because we all know expecting mothers have jobs or have things to do and they're busy and you can't always make an appointment. So mobile text messaging to remind you about your health or what you need to do while you're pregnant would be very good for busy expecting mothers. And also they would like to create wellness programs. So in the example in the book, they talked about in the case study, they talked about Step It Up and Virtual Coach. So these programs are to emphasize activities such as exercising or learning how to cook or just making better eating habits. So these programs will allow you to be more motivated to exercise, or having a virtual coach will help you exercise harder or more often. So all of these are part of directing, because you need to direct people to motivate them. And directing is, okay, we're going to create this virtual coach, we're going to create a Step It Up program, and all of this to get to our goal. And that's part of being a director. And for the final function is controlling. Controlling helps to check error in order to take corrective action. So corrective action, examples of corrective action is like setting standards, measuring actual performances, and taking corrective action in the decision making. So that is all part of control. And examples of control that I found in the book are, they came up with remote monitoring to improve the health of ambulatory patients that have been recently hospitalized for heart failure. This was designed to control and reduce hospital readmissions. They said that the results were the remote monitoring group had lower rates of readmissions than the non-participants of the remote monitoring. They felt it was more important to aggregate external data and integrate it with clinical health information systems and communicate it to patients and providers that are alike. They stated that outcomes in controlled trials demonstrated an approximate 50% drop in cardiac-related readmissions for patients enrolled in the CCP. And those were the 5 functions and the examples that I found in the case study. Thank you so much. Have a good day.